This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Monday morning on WAJR, and welcome to Mon Health Talk. I'm Kyle Wiggs, and we're joined this morning by Tricia Julian, an Oncology Nurse Navigator at Mon Health. And we're going to talk a little bit today on a cancer support group, PB&J, Persevering, Brave, and Joyful. And Tricia, good morning. Thanks for coming on. We appreciate your time.
Good morning, Kyle. I'm happy to be here. Thank you.
We've talked a little bit about this in the past. First, let's start with you. Tell us about what you do. What are some of your day-to-day tasks as you help patients navigate through this very difficult journey?
Well, as a nurse navigator, I do several things. I do education with patients. I now have another navigator helping me do that. We have a financial navigator in our support team that helps patients with financial issues. So navigation is basically just the support of patients from the time they're diagnosed all the way through survivorship.
Mm-hmm. So again, it's a very trying time for these patients and their families, and I would imagine you have many, many years of experience in dealing with this, and every case is different and every case is difficult. So kind of talk about that aspect if you can, trying to suit the needs of the patients and their families.
It is. I've been doing this for 40 years. I got into oncology by default, actually. I went back to work after spending 4 years at home with my 4 children, and there was a position open in oncology. But I chose to continue in oncology because I love the field and the fact that you learn every day. And I now have, after 40 years, our team here at Mon, our oncology team, I call it the dream team. It's everybody that I've ever wanted to work with. It's just an amazing team, and we're able to just fully support our patients, and we actually support patients who are getting treatment elsewhere with our programs as well. So,
okay. All right. PB&J, the Cancer Support Group. What is it?
Yes.
Define it for us.
This is a group that was started to offer a means of support to our cancer patient population. And when I say our patient population, I mean anyone in the community with cancer. Patients are living today so much longer with cancer diagnoses and, in many cases, getting cures for their cancer. And so there's a real need to support them in their cancer journey, no matter what phase of that journey they happen to be in. And
you and your team help organize that and support them as they make this journey.
Yes, we also have great support from the HealthWorks Revital program down at the bottom of the hill. They have been key in helping us with this program. We do a lot with them. They are a group of physical therapists who help support our patients in many different avenues, and so they have been great in helping us with this program.
Okay, so this am I saying it right? PB&J. Okay, right. PB&J. This support group's been going on for a while. In fact, this is the 3rd session. So let's get caught up. What were the first 2 like?
It is. So the first 2 sessions, we had multiple different things in the first couple of sessions. We do 3 sessions, 1 a month, and we do those in the fall, and then we do them in the spring. So we had one in the fall of 24, and then had one in the spring of 24, and now we're having this one in the fall. And previous sessions we've done multiple things. We did a healthy cooking class. We did a meditation and chair yoga class, which was so successful. Tara, my co-partner in this, actually taught that chair yoga class, and that transitioned into an actual series of classes that she's now holding at HealthWorks, which is the most successful class there. It's attended by anywhere from 15 to 20 people. So these sessions not only support our patients at the time, but they actually develop into things that can branch out and help patients continually.
Okay. And session number 3, what can folks expect that get involved in this?
Session number 3 is going to be great. We have tried to provide activities that there's always support. There's always time for patients to talk and to get the support they need. But in addition to that, we wanted to provide activities that would give them some reprieve from their cancer journey and have some fun and be able to collaborate with other patients. So this first session is going to be held at the Wow Factory. It's a paint and sip session. Not sipping alcohol, but mocktails, and we'll have appetizers, and we're going to do some painting, and we think that'll be a great deal of fun. I think we already have 12 or 13 people signed up for that. And these classes create a very strong sense of camaraderie within the patient group. I spoke with one patient last week who's been through both series and has signed up for this series, and she referred to their group as their tribe, and so they've gotten very close. And but having said that, we also constantly welcome new people, and these ladies will take new people under their wing and talk to them about their journeys. And so it's a wonderful way for patients to collaborate with each other and form bonds.
Yeah, and have a support group. I mean, every journey's different, but there are some shared experiences.
It is, yes, and they're always talking to each other and emailing each other, and so it's really a very close-knit group, and we tend to have the same 7 or 8 people come every time, plus some new additions. So.
Okay, so session number 3, you mentioned it's at the Wow Factory. Give us the rest of the details, the date and the time, and how people might get involved if they're interested.
So that date is September 30th, and we do 6 p.m. to 8 p.m., and they can register by calling me at my office at 285-2690, and we will have not only the painting session, we're going to have some appetizers and, as I said, the mocktails there, but we also will have a dinner for them at that time. Each one of these sessions includes dinner. And our next, do you want me to tell you about our
Sure.
next two sessions?
Yeah.
Next 2 sessions. The second session is
We are with Tricia Julian, Oncology Nurse Navigator at Mon Health. A little bit of a phone line issue here. We'll see if she pops back on there. If not, we'll take a break and try and catch back up with her. But I believe her phone popped there right when she was giving her number, 285-2690. I believe that was the number, but we'll double-check that with her when she comes back on, 285-2690, to get involved in the PB&J session, the support group at the Wow Factory, again, September 30th between 6 and 8 o'clock. And I believe we've lost her. So I'll tell you what, we'll take a break. We'll try and reconnect. This is Mon Health Talk for this Monday, and we're visiting with Tricia Julian, Oncology Nurse Navigator at Mon Health. We're talking about the PB&J support group, and we will continue the conversation on WAJR after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday, visiting with Tricia Julian, Oncology Nurse Navigator at Mon Health. We're talking about the latest installment of the PB&J Cancer Support Group. It's coming up September 30th, a paint and sip event at the Wow Factory. And Tricia, are you back with us?
Yes, I am.
All right, we lost you there.
Can you hear me all right?
Yeah, we've got you. Now,
sorry.
your phone popped right when you were giving the phone number, so I think it's 285-2690. Is that correct?
That's correct.
Okay.
And we really do need for people to register for these sessions so that we can plan for food and plan for accommodations for everyone.
Okay, so 285-2690 for the September 30th paint and sip at the Wow Factory. And then we lost you right when you were talking about sessions 4 and 5 coming up. So why don't you go over that again?
Yes. Our second session will be October 28th. Again, that's on a Tuesday evening from 6 to 8. And this one is going to be at HealthWorks near the Mon Health campus. And it features a water aerobics class. But we also will have an instructor poolside to conduct a class for those who don't want to get into the water. And again, a meal is provided, and they also get a free T-shirt at these classes. So that one should be a lot of fun as well. And then we have November 18th, our core group of people who come to our support group sessions wanted to do a service project to help other cancer patients. And so we decided to do a service project, and we're putting together an activities cart for our infusion center that's going to be stocked with all sorts of activities for patients to do while they're getting treatment. So our attendees will help us get that cart up and running and help us with that, and then have a meal there as well.
Okay. So again, the Wow Factory event, September 30th, the HealthWorks event, October 28th, and then the service project on November 18th. And call Tricia at 285-2690 to register if you're interested in any of those. Now, Tara was going to join us through no fault of hers. It was our fault. But Tara called in, was going to join us from HealthWorks. So let me just ask you about this partnership between Mon Health and HealthWorks for this event. It seems like a natural because, you know, your facilities are close together, and I know you work very, very well together.
It is. The Revital program I mentioned earlier is a group of physical therapists who are personally trained to help with issues that cancer patients have, things like peripheral neuropathy, they help with things like fatigue. They can help with myriad issues that cancer patients might have. And so it was a natural collaboration for us to join with them to come together and do these support groups, and they offer all different types of things. I mentioned Tara did some meditation with patients and some chair yoga, which were both met with real enthusiasm by the patients, and they can help us with all sorts of things that will physically help patients and mentally help them as well. So it's been a wonderful collaboration.
Now, I know their Revital Cancer program, we've done programs with HealthWorks representatives on the Revital program. They have an Ask the Experts segment once a month as well on Wednesdays. That Revital program has really, really helped a lot of patients.
It really has, and we have a physician in our program that actually has benefited tremendously from that program and personally, and he's out there spreading the word that to patients that he has personal experience with it and that it's working very, very well, and really encourage patients to get in there and try the program.
Mm-hmm. Well, this is great information, and it's a great program. You've developed a very nice support system for people dealing with very difficult issues. If someone's out there listening and they're thinking, wow, that sounds like something I'd like to be involved in, but they're a little bit hesitant, what would you say to encourage them to pick up the phone and call and get involved?
Kyle, what I would tell them is to just come to one session. You don't have to commit to all 3 sessions. You can come, try it out, see what's going on with it, and then make a decision as to whether you want to continue with it. I think that the first thing that comes to my mind when I think about these sessions is all the laughter emanated from these sessions. Someone was walking down the hall during one of our sessions and told us that they could hear laughter all the way down the hallway. And it's just been a wonderful way for patients to unwind and connect. And it's been a place to verbalize their feelings and develop new relationships. So I would just highly encourage them, anybody who is looking for extra support, who's looking to connect with patients who are having the same experience that they're having. We really place a lot of emphasis on patients living their healthiest version of their life in survivorship. So we welcome everybody.
Yeah, and part of that healthy lifestyle is friendship and companionship and laughter, just like you said.
It absolutely is, yes.
Okay. All right, let's recap real quick. We're talking about the PB&J Cancer Support Group, a combination between HealthWorks and Mon Health. And these sessions, they're a lot of fun, and they've helped many people that are going through that journey of cancer recovery and survivalship. So Paint and Sip at the Wow Factory, that's September 30th between 6 and 8 p.m., and then the session at HealthWorks, October 28th, which will include a water aerobics instruction and class. And then they're working on a service project on November 18th. So any of those sessions, if they interest you, give Tricia a call at 285-2690. And she's got the list there. She can register you, and you're good. You're good to go for that. Anything else you'd like to add about this program and the way it's helped people, Tricia?
No, I just think that that the patient who called their group, their tribe, just really spoke to me about the relationships that have developed from this support group, and I think it's of great importance to get that support during your cancer journey. And many people don't have that, either within their family or within the place where they're getting treatment. So we highly encourage you to come out and receive that support that you need.
Mm-hmm. All right, absolutely. Again, call Tricia at 285-2690 as the latest round of sessions for the PB&J support group, the cancer support group, are ready to take place. Tricia, again, great information. Thanks for doing this, and thanks for coming on the radio to talk about it. That's how it spreads, word of mouth.
We appreciate you helping us get the word out, Kyle. Thank you so much.
All right. Thank you, Tricia. That's Mon Health Talk for this Monday. Thanks for listening here on WAJR.